Hey, what's up? Sterling here from Vagus Nerve Stimulation and Repair. Today we're going to be covering a really cool latest breaking development, which is that they're now using ultrasound on the spleen to treat COVID. So they're using pulsed low-intensity ultrasound to stimulate the human spleen to basically overcome some of the inflammatory damage that can happen from COVID. So we're going to dive into the latest news here from UC San Diego Health. But this is breaking news. This just happened in the month of May. And they're doing a pilot study to evaluate whether ultrasound stimulation focused on the spleen can reduce inflammatory biomarkers in hospital patients infected with SARS-CoV-2. So this will allow us to determine whether treating patients this way can really affect clinical outcomes in COVID-19 infections. And to a large degree, I totally could see this actually working. Big reason why is there are T cells in the spleen, T cells, B cells that respond to ultrasound. There's some other research that I've come across that shows that what makes ultrasound on the spleen effective is the T cell count. They did a study where they genetically knocked out T cells in the spleen of a rat and found that ultrasound was no longer effective. So as long as there are active T cells in the spleen, then you can activate like macrophage, anti-inflammatory processes. So I could definitely see ultrasound being used as a therapy to prevent the severe damage that is often caused by COVID. So yeah, so here's how the protocol works basically. So I believe this is so it's 40 patients, all with severe COVID-19 symptoms. Half the patients will be given ultrasound for 7 days on a daily basis, in addition to receiving anti-inflammatory drugs such as remdesivir and dexamethasone, which are currently part of standard medical care. The other half, the control group, will only receive standard medical care. So we'll be watching to see how quickly the ultrasound patients can be discharged from the hospital compared to the control group. While we're planning to do the ultrasound treatments up to 7 days, we're hoping that ultrasound stimulation of the spleen can get them home even sooner and also prevent patients from experiencing more severe symptoms while in the hospital. So that's pretty cool. So in early rodent studies, stimulating the spleen with non-invasive ultrasound was shown to reduce inflammation. Researchers have also demonstrated the anti-inflammatory value of spleen stimulation in healthy human subjects and in human patients with rheumatoid arthritis. Now that's true, you're reading that right, or you're hearing me say that correctly, which is that rheumatoid arthritis treatments do come from ultrasound stimulation. And I've seen this many times in my clients is specifically the reduction in rheumatoid arthritis symptoms from the treatment of their vagus nerve with stimulation with ultrasound. So it's definitely true that works successfully. So both RA and COVID-19 patients can suffer from hyperinflammatory response driven by overproduction of cytokines, the proteins that signal and spur an inflammatory immune response. The resulting cytokine storm, we see that a lot in COVID-19 patients, can lead to acute respiratory distress syndrome known as ARDS, which can be fatal. So let's see. Got it. And so GE and the University of Minnesota did a test showing non-invasive ultrasound activation of the splenic neuroimmune pathway, which is the vagus nerve. May it provide an alternative method to combat the cytokine storm without compromising the adaptive immune response to COVID-19 patients, ultimately reducing the high mortality and morbidity rates confronting this worldwide pandemic that currently has limited treatment options. So now the clinical trial will use an investigational device developed by Second Wave Systems, and it's called the UNITE study. So I pulled up Second Wave. This is their website. So wearable adaptive non-invasive therapy. It's developing a non-invasive wearable ultrasound system that will give patients and physicians a new option for treating debilitating or life-threatening disease. Now, something that's similar to this, that looks similar, is it seems a lot like the company called Okta. But I don't know if there's any overlapping teams. It doesn't look like there's any overlapping teams here. But I would imagine that I think this is Minnesota, the skyline of Minnesota. So I believe it's a Minnesota company that is doing this. Is this available to the public? Not at all. You definitely can't go, only unless you want to become a test subject and get COVID to test this. This is not something that's readily available yet. So don't hold your breath. These kinds of things will take a long, long time. It's a 2 to 3 month study. I'm sure they're already well along in this process. So yeah, that's it for this video. Just wanted to share some updates in terms of the world of ultrasound stimulation of vagus nerve related organs, spleen in this case, the neuroimmune function, to fight COVID. There's a lot of different uses for ultrasound on the vagus nerve on different parts of the body. So we'll be exploring some more of that from a really kind of a biotechnology clinical perspective, just hopefully in a way that's also entertaining as well. So yeah, that's what the device looks like. It's a small little puck that you essentially place. That's called the transducer. There's got to be a driving circuitry behind it. There's probably going to be a big box about yay big, maybe this big, this tall, with dials, and you select settings. I would imagine that the company that could have been behind this was Sonic Concepts, based out of Bothell, Washington. They typically design more investigative devices like this in these days. So also, it looks like Qualcomm Institute. So I wonder if they had some Qualcomm stuff in there, but I doubt it. Ultrasound's very specialized. Qualcomm doesn't make ultrasound equipment specifically. So that's it. Thanks for watching. Sterling here from Vagus Nerve Stimulation and Repair. Check out the links in the description of this video, and you can follow me on other places, specifically Facebook. Join our Facebook group. Learn more about vagus nerve specific stimulation using all kinds of technologies. So thanks so much. Talk to you soon. Bye.